Hey everyone, in this video we are going to be discussing about the spina bifida. So what is a spina bifida? It is basically a neural tube defect and it happens when the neural tube doesn't close all the way. It usually occurs at the lower back. When the neural tube doesn't close all the way, it leads to the failure of the mesenchyme to organize properly. And when the mesenchyme doesn't organize properly, what happens is that it leads to the improper formation of the vertebra. The vertebra formed lacks two things, the spine of the vertebra and the arch of the vertebra. And because of this, it forms the posterior opening of the vertebra. And that is what is referred to as a splitting of the vertebra, that is a spina bifida. So the word spina means spine and the bifida means split, which is a splitting of vertebra. Then this condition happens most frequently in the lower thoracic, lumbar and the sacral regions. Now as you can see in the figure on the right side, the failure of the neural tube to close leads to the failure of the vertebra to close completely, and that is why there is no posterior protection to the spinal cord. So the spinal cord in the affected area is very much prone to damage and infections. Then let's come to this figure which you can see here. So neural tube starts to fuse at the 21st day and it closes at the 28th day. So it means that from the 21st to 28 days, these are very critical. If we talk in practical terms, the neural tube defects, they occur before the women know that they are expecting. So if they are not taking a good diet or a diet that is rich in the vitamin B9 or which is also known as folic acid, so there are very fair chances that her infant would develop the spina bifida. Now there are some types of the spina bifida which are mentioned here. So these types are basically on the basis of what is going to protrude out of the opening which is present in the spine. So whether the spinal cord comes out of it, or the meninges would come out of it, or the both, or nothing comes out of it, or there are many other types as well. So the first three types which you can see here are the major types, which are the spina bifida occulta, meningocele, and the myelomeningocele. Then the other four types they are actually rare, but I have also mentioned them, and these are myelocele, syringomyelocele, lipomeningocele, then we have the spina bifida ventralis. And I've also mentioned the meaning of these terminologies so that it is easier for you, and it is important to you to learn them right away to relate in your minds what they mean in the later slides, right? So the myelo means spinal cord, meninges is a protective covering of the spinal cord, then the cele means the swelling of the sac, lipo means fat, occult means hidden, syrinx means cyst, ventralis means anterior, and the bifida means split. Now let's come to the first type of the spina bifida, and that is the spina bifida occulta. Now the occulta here is a Latin for hidden. So from the name, it is telling you that the spina bifida is hidden. Why it is hidden? It is hidden for the two main reasons. First of all, the main reason can be that there is no protrusion of anything, neither the spinal cord nor the meninges are protruding out of the hole or the opening in the spine, right? That is why it is hidden. The second reason is that this opening is covered by the thin layer of skin, as well as the posterior vertebral muscles are also covering this gap. That is why it is hidden. So that it is not diagnosed right at the birth. Hence, it would be diagnosed later in life, and it would be when the person would by chance get his x-rays done. In some cases, over the defect, you can see the tuft of the hair or the dimple, or there may be some discoloration of the skin, which might be referred to as a birthmark, or there can be a fatty tumor over it, which is lipoma. Now, as I've told you that in this type, the spinal cord is not going to protrude out of it. That is why it won't get damaged. And so it would produce no symptom. So this condition is symptomless. Then the spina bifida, it might cause the physical or intellectual disabilities that range from mild to severe, and this severity depends upon the size of the opening and where the opening is located and whether the spinal cord and nerves are affected or not. So this was about the spina bifida occulta. Let us move to the second type. The second type is the meningocele, which is also known as a meningeal cyst. So, what you can get from this terminology is that the meninges are gonna protrude out of the opening and they are gonna protrude out in the form of a swelling, right? Now, as the spinal cord is not protruding out of it, that is why there is no damage to it and it is not gonna produce so severe symptoms. So, the spinal cord and the nerves usually are normal. Then, the third type is the meningomyelocele. So again, this terminology is itself giving you the meaning, the hint of what that would mean. So it is basically if the meninges and the spinal cord both are protruding out of the opening in the form of swelling. So now the spinal cord, as the spinal cord is also protruding out of it, that is why this condition is very much, you can say it's fatal, because now the spinal cord can be very easily damaged or it is very much prone to infections. Okay, in normal cases what happens is that this condition is covered in the skin. That is why there is, you can say, a bit of protection that is given by the skin. Okay, but in some cases, when the skin is also absent, what happens? This condition is known as an open spina bifida, and then the spinal cord is very much prone to the infections and damage. And that is why it can lead to the series of, or we can say, the ranges of the symptoms. So, it can produce these following symptoms, like it is responsible for the loss of sensation, paralysis, bladder bowel movement problems, or the seizures or the lack of foot deformities. The meningomyelocele is also associated with the Arnold-Chiari-2 malformation. Now, what is it and how the myelomeningocele is related to that? So, basically, as I've told you, that in the meningomyelocele, what was protruding out, the spinal cord was also protruding out, and so this spinal cord becomes adhered to the sac. And when the spinal cord becomes adhered to the sac, what would it do? It would exert a downward traction on the parts of the brain, like the cerebellum and the brainstem, and these structures would slip down into the foramen magnum, and there is a blockade, or you can say if there is any obstruction in the CSF flow, so that can lead to the hydrocephalus, and it can also produce the symptoms of the cerebellum. So that is what is the Arnold-Chiari-2 malformation. As you can see in the figure below, that there is the protrusion, and the part of the cerebellum and the brainstem, they are slipping down into the foramen magnum, and that is what leads to the hydrocephalus. Okay, then we have a fourth type, which is a myelocele. Now, this is a kind of rare disorder, and as you can see in the figure, an oval raw area, and the neural groove can be seen whose lips are fused together, and there is basically a flat neural plateau that is exposed to the environment. The central canal discharges the clear CSF onto the surface. Then we have a fifth type, which is a syringomyelocele, and this as well is a rare condition. So in the syringomyelocele, we can find the meningomyelocele. So the meningomyelocele is present here, as well as there is one more feature, that is the central canal is dilated. So you can relate it with this figure, that you can see there is a widened central canal. Okay, so it shows that the central canal has been dilated, and there is also a protrusion of the meninges and the spinal cord. Now we have the second last type, lipomeningocele. Okay, so as the name is telling you, there would be the protrusion of the meninges in the form of swelling, and that would be accompanied by the deposition of the fat tissue. Then, as it is covered in the skin, so it doesn't require any surgery at the birth. Okay, now we have a seventh type, which is a spina bifida ventralis, an anterior opening. Now it is much less common type as compared to the other forms of the spina bifida, and in this condition what happens is that the meningeal sac it protrudes into the retroperitoneal space, and it also impinges on the retroperitoneal organs like duodenum, ascending descending colon, kidneys, adrenal glands, pancreas, aorta, inferior vena cava. Okay, then now we're going to discuss what is the health status of the persons who are affected by this condition, and the incidence, epidemiology, the causes, and how we can manage that, what is the prevention, and the social impact. So the first is the health status. Now gone are those days when the children affected from this condition would die because of the infection of the spinal cord. Now the advancements in the medical and surgical care has prolonged the life of infants, but unfortunately, because of the irreversible neuronal damage that has occurred to them, they can have a lifelong disabilities and the psychosocial problems. Now the incidence and epidemiology. So the worldwide incidence is 1 to 2 cases in 1000 births, and it is not too less. Then in United States, the incidence is zero point 0.7 per 1000 live births. The incidence of spina bifida is higher in the East Coast, in the Irish immigrants, and it is slightly higher in the Caucasian population. And these cases are seen more in the children who are born in the late summers and early fall. Then, talking of the causes, so the exact cause of spina bifida is unknown, but the risk factors are many. They have been identified. Like the first, the main cause is the folate deficiency. Although the folic acid is not a guarantee that the women will have a healthy pregnancy, but taking folic acid can help reduce the women's risk of having a pregnancy that is affected by the spina bifida. Obesity can also be a risk factor. Then, according to some studies, the environmental and genetic both can be a risk factor. Then, poorly controlled diabetes and the medications that interfere with the folate synthesis, like we have the anti seizure medication, for example, valproic acid, which we use to treat the seizures, convulsion, bipolar disorder, migraine. So, it can be an important risk factor. Then, how we can manage it? So, in the management, it includes the diagnosis, treatment, that is surgery, and the antibiotics, careful observation, and the physical therapy. So, first of all, the diagnosis is often done prenatally for the detection of the increased alpha fetoproteins in the mother's serum. This AFP is basically released from the fetus affected opening in the spine through the amniotic fluid in the mother's serum. But as this AFP can be raised in many other conditions as well, that is why the other blood tests should also be performed. Like, so these blood tests would be tested for the human chorionic gonadotrophin, inhibin A, and the estriol. Then the ultrasounds can also be performed. For example, as you can see in the picture right here. So there is a very well protruded sag, or you can say a cyst, that is formed on the back of the infant. Then the amniocentesis can also be performed. So in the amniocentesis, what happens is that you take a sample from the amniotic sac and then you get it tested. Then we have the treatment. So as you know that the treatment would basically be according to the severity of the condition. So as you know that spina bifida occulta is such a mild type, and it doesn't involve any protrusion of anything, that is why it will require no treatment. Then if the person is suffering from the meningocele or the myelomeningocele, so he should definitely need the treatment, and that treatment would be surgery. Now, in the surgery, what a surgeon would do, the surgeons basically they place the spinal cord or the nerves and meninges, whatever has protruded out. So they place them in the right place, and then they would cover the gap, and then they seal that gap with the help of the posterior vertebral muscles and then the skin. So in this way, the surgery is done. Now, the surgery can be performed prenatally and postnatally. The surgery is performed prenatally to close the myelomeningocele, which is a very dangerous type. And this surgery can be dangerous for the mother and as well as for the fetus. Here in the figure, you can see the surgery is being performed in order to close the neural tube. Okay, and then the postnatal surgery is performed within a few days of birth in order to minimize the risk of the deadly infections, for example, meningitis. Then the additional interventions can also be given, for example, the urinary catheterization to the patients who are having any incontinence, right? Then the wheelchair or the crutches can also be given to the patients, as you know that the spinal nerves cannot be repaired. Once injured, they are injured, okay, because they are not reversible. And these treatments, these additional interventions, they can be given on the basis of the level of the lesion. For example, if the lesion is above or at L3, then the patient is having bladder incontinence and non-ambulatory. That is why these, you can say, the catheterization is given and wheelchairs can be given, right? Then, if the lesion is at the L4 or below L4, then the patient is ambulatory with the aids, so you can give him the crutches. Then, if there is any damage at the S1 or below S1 levels, then the patient is ambulatory with the minimal aids. S3 and below S3, then the patient would have the normal lower extremity motor functions, and but there would be variable bladder rectal incontinence. Okay. Then we should rather give them antibiotics if in the cases the spinal cord is exposed to the environment. That is why we should give them, because in that cases the spinal cord is very much prone to the infections. The careful observation should also be performed. So, for example, if you're not specific which kind of spina bifida they have, and you are just, or the patient is just suspected of having a spina bifida, and he's also having a hydrocephalus, then you should promptly diagnose him of the myelomeningocele, which is the most dangerous type of the spina bifida. And any changes in the mental status or the behavior should be quickly brought to the attention of the child's physician. Then the physical therapy can also be performed in the case of spinal cord damage, because you know that the spinal cord damage can lead to the muscle weakening and wasting, and it can also make the person paralyzed. Now the speech therapy can also be helpful for some individuals, and these therapeutic programs which are done under the physical therapy, they are to achieve the normal gross motor milestones, and they are used to provide the caregivers with instructions how to handle these patients, and they recommend the orthotic positioning devices so that the contractures can be prevented, and also they provide the effective means of independent mobility, and in conjunction with the therapeutic exercises, so that they can have a good control of the trunk muscles of the trunk and their balance. And if the patients are non-ambulatory, then you would also teach them the skills in order to use the wheelchair. Then for the pre-gate training, the parapodium or the swivel walkers are recommended, and the traditional long leg braces. We have the RGO, the reciprocating gait orthosis. They can also be recommended. Occupational therapy is done so that they can perform their ADLs in a better way. Then recreational therapy is done to decrease the negative impact on their normal development and the sense of the self-esteem. Then how the prevention can be done? So the prevention can be done through the education, that the education should be imparted to those women who are of the childbearing age, that the neural tube, it begins to close at 22 days after conception and it closes around 28 days. So they should know that. And further, they should also be told about the folate intake, that the recommended dose the women of the childbearing age should take, that is 400 microgram of the folate per day, and if the woman is pregnant, then she should take 600 microgram of the folate per day. And the women who had a previous child that was suffering from the spina bifida, then they should take more doses of the folate, that is 4000 microgram of the folate per day, as folate can decrease the risk of spina bifida by up to 75%. Then, what is the social impact? Prognosis and any deficit, they depend upon the level of involvement. However, these children, when treated earlier, they can have a normal IQ and they are able to attend the public schools. But as their mobility is the biggest concern, so this mobility can be a cause of their becoming obese and scoliotic, right? But with the proper treatment, these individuals will live well into their adulthood. So that's all from my side. I hope you learned something from this lecture, and I hope you enjoyed the video. Thank you.